We're taking a closer look today at an issue that affects millions of people, irritable bowel syndrome, or IBS. Of course, the more you know about the condition, the better you'll be able to manage your health. So joining us today is Dr. Barakat Altamimi, gastroenterologist at Mercy's GI Clinic. Thanks for joining us today, Dr.
Thank you for having me,
Altamimi.
Karen. I really appreciate it.
So IBS, or irritable bowel syndrome, what is that?
So it's one of the GI disorders that is characterized by abdominal pain and altered bowel habits.
I'm assuming this is relatively common.
Yes, so it affects about 15% of the population. Now, interestingly enough, it's not everybody seeks medical attention, so the likelihood is that it's even higher, and it just goes underdiagnosed.
Well, you do often hear people maybe just make mentions about, they don't feel good or they have to use the bathroom a lot or they're bloated. And so maybe that's getting into that issue a little bit. Yeah.
Yes, it is. As I said, it's a common disease. We have a specific criteria that we use, something called the Rome criteria. We have the latest version, is version 4.0. That helps us classify what IBS is. For us to be able to label a person to have irritable bowel syndrome, they usually will have to have abdominal pain, at least on average, at least once a week, if not more, and that pain has been present for at least 3 months. You will also have to meet 2 more other criteria out of the next 3 to be able to label it as IBS, and that is a change in the stool form, stool frequency, and the problem being related to defecation.
So what is at the root of this problem? Why are so many people experiencing this?
It's a disorder of the gut-brain axis. Pretty much the signals that go from the gut gets processed in the brain, and somewhere along the line there is some sort of miscommunication and people will have pain. It's usually also associated with other issues like anxiety and depression. But the root cause is a gut-brain axis issue.
That is surprising to me that it has that much to do with your head as it does with your bowels. But that obviously is something that's happening with that condition.
Yes, it is. There are different subtypes of IBS because for our listeners, they might just know the word irritable bowel syndrome, but we do have the different specific classifications for them. So we have constipation predominant, diarrhea predominant, mixed, which would have both constipation and diarrhea, and the 4th one is unclassified form.
So I imagine that people, when they come to see you, are somewhat reluctant to talk about this. This is a difficult thing to talk about, for a lot of people. So do you see that with your patients?
Very frequently. Now, a lot of people feel shy. People do not usually talk about their bowel habits, let's be honest, and it's something that people feel embarrassed about, but it's there and it's common, and people should not feel shy or anxious, and they shouldn't even be reluctant to talk with their providers about it. It's more common than you think. It's just that during your morning coffee and when talking with your friends and colleagues, you do not usually talk about your bowel habits or the bloating that you had the last night. So what I'm trying to say here is I encourage everybody to just talk with their providers, and there are professionals that take care of these things.
And you don't have to suffer through it.
No. A lot of people suffer in silence, and I don't think that's fair for them. It's a quality of life issue, and it's really great not to have abdominal pain, nausea, pain, bloating, and so on.
So who is most at risk for this?
Younger individuals. So it usually happens in the younger population a bit more frequently than the older population.
What treatments are available out there, or what advice would you just give to people in general to try to avoid, experiencing this?
Before we talk about the treatment options, I just want to make it clear that you should talk with a professional to make that diagnosis and not just self-diagnose. There are certain alarm symptoms or red flags, if you might call it, that tells us that this might not be IBS, and it's necessary for a professional to be aware of them so that they can take necessary investigations and treatments. So some of those red flags or alarm symptoms include like unintentional weight loss, IBS should not be related to bleeding, for example. So if you see blood in your stool, that's a red flag. Um, as we previously mentioned, it's a symptom that it usually occurs in the younger individuals. So if it occurs after the age of 50, that's a red flag as well. So I'm asking that people do not self-diagnose. It's usually a diagnosis of exclusion, and you have to have a healthcare professional make that diagnosis. Now, in regards to the treatments, usually the focus is to try and manage the underlying issue. So in general, fiber is the best friend for a gastroenterologist. A lot of the issues that we deal with can be managed with some extra fiber. So if they have the IBS diarrhea or constipation, usually that's what we start with. And I just want to point out that we're looking for soluble fiber, not the insoluble one. Studies have showed that soluble fibers do better when we're dealing with these issues. Now, even more paramount to all of these treatments is having a good physician-patient relationship. And we pride ourselves here at Mercy with our level of commitment to our patients and our relationship to them. So that is one of the important factors when dealing with this. Knowing that you're not alone, knowing that there are a lot of other people who have to deal with something similar to that, and knowing that there's somebody listening and trying to help you go through this.
So, once it's diagnosed, are there very specific treatments, or is it really individually focused about diet and lifestyle kinds of changes?
It's multidisciplinary, as you might think. It really requires multiple players in treating IBS. So if there's any underlying mental issues, then yes, we would get, for example, psychiatry involved or a psychotherapist involved to manage the anxiety part or the depression part. In regards to the diet, yes, we have certain diets that we use. And I do want to point out that usually when GI issues come, they come in clusters. So it's not that people will have just the IBS. They might have things like fructose intolerance, lactose intolerance. And there's where diet would really be helpful. Now, regarding treatments, so it's usually individualized. The focus is to try and see how bad is the disease and try to target it so that you do not change one thing into another. What I'm trying to say here is if a person comes to me with irritable bowel syndrome with constipation predominant, I can give them medication, but I might switch it from constipation all the way to diarrhea. And they'll be like, oh, I resolved one problem for another problem. So that's where individualized treatment comes in play.
This is just one of many digestive conditions that are out there. And what are some of the others that you most commonly see? And I guess, we can direct people, where to get some help.
It's one of those systems that is open to the outside world. It's responsible for absorption. It also has a big immune system involved to keep the bad things out and the good things in. So pretty much we deal with things all the way from the swallowing tube all the way to the anal verge, and the symptoms vary drastically from your usual nausea and vomiting to your abdominal pain, diarrhea, constipation, even bloating. So the constellation of symptoms is pretty much wide, and I would encourage patients just to talk to their providers about any of those symptoms that they are worried about or if it's affect their quality of life. You don't need to be embarrassed. You do not need to be shy. When you see your provider, know that we look at you with an open heart, and we just are here to help. That's one of the unique things about Mercy is that Mercy Touch.
Well, thank you for this candid conversation, Dr. Altamimi. We appreciate it. And we should let folks know that if they want more information, they can go to the Mercy website, mercycare.org/GI.
Thank you very much for having me, Karen.
Sure.
Really appreciate it. Thank you.